and welcome to the second half of South Texas Crossfire. This is your host, Attorney Joe Flores, reminding you to join us each and every week. And in Laredo, this will be our second segment over 2 weeks. And also, don't forget, CBS, KVTV, and also San Antonio, Time Warner Channel 21, and in Corpus. And don't forget, we are loaded up on YouTube, and you can also go to our site, southtexascrossfire.com. If you're just joining us, pull up a chair, get some popcorn, and get a nice pop soda, because we're going to be talking to a premier Texas lawyer, Charles Houssiere. Welcome back, Charles.
Thank you.
Thank you for joining us for our second segment. I know you're busy, and well, the Vioxx cases too. You know, I was talking to your right hand, Monica Vaughn, the other excellent attorney here in the office among many. And so you promised that we talked about the medical malpractice, and you promised a very interesting interview also, because products out there. We talked about medical malpractice. Now, that is a very, very important issue. It's affecting a lot of people throughout the lifespan, and it affects doctors as well as insurance companies and the legal system. But now we're going to get into something also that's going to also educate you on the law, and that's product liability. But before we get there, feet first, remember that this does not constitute legal advice. Call the attorney of your choice. We are just talking about this in generalities here. But Charles, let's jump in feet first. I noticed you brought some props here with you. I wanted to ask you about that. I mean, my curiosity is just on fire there. You've got some knee replacements, or what is that there, Charles?
Yes, they are. This is the femoral component of the knee, and this is the tibial component. This particular knee implant is manufactured by a corporation called Smith Nephew. It was brought out in 2003 as the go-to knee. It was the thing, but they failed. Under Texas law that applies to all products, what one looks at is the product unreasonably dangerous to the ultimate user and consumer? That's what you look at. And if it is, the company is at fault and must pay the damages that are produced by this unreasonably dangerous product. You're not looking at whether they were negligent or should or shouldn't have done something. If the product is defective, that establishes liability in the state of Texas. This particular implant has been recalled. And you might say, well, how did it get on the market in the first place? How could this possibly be out there? Well, the answer is that companies like Smith Nephew go to the FDA and say, this device is substantially equivalent to another device that has been approved by the FDA and has gone through pre-market approval, rigorous study. Not this one. This one is just substantially equivalent. Take our word for it. The FDA, understaffed as they are, says, okay. And it gets out on the market. When it goes into human beings, you are the study. You're the guinea pig. What happens is when you get arthritis in your knee, doctors, orthopedic surgeons must go in and remove knees on occasion when they get so symptomatic you can't stand it any longer. So what do? They replace it with metal knees. And metal knees or ceramic knees have progressed over the years. This one was supposed to be the latest and greatest. The articular surface, or surface that actually that you slide on when you bend your knee, is very smooth. This is made of a new type material. It's actually an element, zirconium, which they called oxinium. And this articulates on the plastic component on the lower part of your leg as you move. And the idea is you replace that worn out knee that you have that's arthritic with this. Obviously, you don't want this moving around. You want it to stay steady. This one has a post. It has bone cement on it and is cemented down into the tibial component. This part is not cemented. So if this is your knee and you remove the portions of the bone that is diseased, and then put this on top of it to fit right over it like a cap, then it needs to stay where it is put. So how's this going to stay there if it isn't glued in? Believe it or not, this company said, well, we'll just make it rough in here with some special rough type material, and this will grow into your bone. Now, there are other devices out there that actually do work in that manner. But soon after these were put in, they stopped working. The macro-textured portion of this device is not compatible with human bone tissue for some reason. And then it became loose. It damages the bone further. It then will move while you walk and must be removed. The company didn't tell the people that bought this device, we've got a problem, please contact us. They sent a letter to the physicians and said, well, if they come in, let us know. But we're recalling all the others, don't put any more in. So the poor patient, 2 or 3 years later, wanders in with this having eaten away at his bone and in pain. He doesn't know how much pain he should or shouldn't have, or she should or shouldn't have. And the doctor says, well, it's another one, we got to take it out, and they replace it. Unfortunately, the replacement surgery is highly expensive, and when you have replaced it a second time, the likelihood it's going to fail another time is much greater and much more extensive that time. And many of the knee implants that are replaced the second time, for some reason, are not holding in the knees that have been damaged by this odd material that they put on the inside of this knee implant.
Well, and that is a great example. I'm glad you brought those out because it's something concrete so people can understand what is going on. And this is just one product. Now, there are other medical products out there, aren't there, that are affecting people, well, I mean, Vioxx and, pharmaceutical, intervention and pills and things are one thing, but medical devices, what other examples of medical devices are you working on so people out there know? Because it kind of ties in with medical malpractice, but also this is now medical as far as device malpractice or litigation. Can you tell them a little bit? What
Sure.
are some other examples?
We'll run through some of these. Again, this is money. This is let's sell somebody a product. For instance, we're working on a case against a physician here in Houston who has been indicted by the government and will be sentenced soon for selling fake Botox, which is one of the most dangerous materials known to mankind. And she was taking pure animal-grade experimental Botox and injecting it into women's faces and bodies. That's one product. Another product is the noontime facelift, where they take these devices like strings with little fish hooks during your lunch hour and put them under your skin and pull your face up. Unfortunately, they fail. And then they're in there, and how do you get them out? Another device is a device that has been made by pacemaker companies, leads that go down into the heart that are breaking and coiling up and causing clots in the heart and death. There are devices that go into what is known as a subclavian artery here that goes down into the heart, that the part that is a catheter that goes down the heart is failing and flowing down into the heart. There are many, many, many products that are manufactured by many of these companies out there that are trying to make a profit off of medicine, not the doctors. The manufacturers of these products are trying to make a profit that simply have not been properly tested and fail.